Before we show the data, I want to pause and explain these three terms that you'll hear me reference. Cocaine-involved deaths are deaths for which cocaine contributed to the death. Other substances may have contributed, but at least one was cocaine. Opioid-involved deaths are deaths for which any opioid, including fentanyl, contributed to the death. Other substances may have contributed, but at least one was an opioid. Similarly, fentanyl-involved deaths are deaths for which fentanyl specifically contributed to the death. Other substances may have contributed, but at least one was fentanyl. The majority of fatal overdoses involved illicit drugs. The proportion of fatal overdoses involving only illicit drugs has increased over time, while the proportion of fatal overdoses involving only prescription medication, as shown in orange, has decreased. Were there new trends of substances contributing to cause of death in 2020? To answer that question, let's take a look at the trends by select substance. The proportion of fatal overdoses in which alcohol also contributed to the death remained relatively stable over time, but has increased in recent years. 1 in 3 accidental drug overdose deaths in 2020 also involved alcohol. 1 in 2 fatal overdoses in 2020 involved cocaine, and this is an increase from 1 in 4 in 2009. About 3 out of 4 fatal overdoses in 2020 involved fentanyl. 2020 saw the highest proportion of deaths involving fentanyl after a slight decline from 2018 to 2019. Now let's take a closer look at cocaine-involved fatal overdoses. About half of the fatal overdoses in 2020 involved cocaine. We're going to focus in on those deaths specifically. Among cocaine-involved fatal overdoses, 3 out of 4 also involved fentanyl. As a reminder, these data cannot tell us about intentionality of drug use or drug use behavior, but can tell us what contributed to cause of death.